The Taylor Hooten Foundation was formed in memory of Taylor Hooten, a 17-year-old high school athlete from Plano, Texas. Taylor took his own life on July 15, 2003, after using anabolic steroids. Taylor's parents, family, and friends founded the organization after learning of the growing number of middle school, high school, and college students illegally using anabolic steroids, human growth hormone, and other appearance and performance-enhancing drugs. Our objective is to educate as many kids and their adult influencers as possible around the United States, Canada, and Latin America about the dangers of these substances. Research has shown a significant gap between the attitudes and awareness of parents versus those of the kids. Many adults think random testing is the answer, but the kids know better. Search online for how to beat a steroid test and you'll get almost 2 million hits. This knowledge gap must be closed, and education is the way to make this happen. We are literally the only national voice in the U.S. on this subject. We're successful because we have credibility. Our founder has testified before Congress on 3 separate occasions and is seen as an expert in this field by major media across the country. Further, we have the backing of several significant organizations, including Major League Baseball, the National Football League, the National Hockey League, the National Baseball Hall of Fame, the World Anti-Doping Association, the United States Anti-Doping Association, and many others. We know from research and experience what works and what doesn't. Our education programs take a very pragmatic look at the issue and present our audiences with the facts about these drugs, where they come from, how they're made, why they pose a risk to the user, basically, why they shouldn't be used even if they weren't illegal. Unlike some groups, we don't use scare tactics and we don't overwhelm the audience with medical or technical talk. We present the facts and let them come to their own conclusions. This approach has been tested and found to be effective by SAMHSA, the Substance Abuse and Mental Health Services Administration. The core message of our program changes awareness and attitudes in a significantly positive way. SAMHSA has conducted pre- and post-test surveys with our audience and documented our success. Therefore, our metrics literally come down to the number of people we can reach, and this is a direct result of available funding. Many schools and civic organizations would like to expose our message to their audience, but don't have the funding to cover our program fees and travel expenses. The equation is simple. The more funding we receive, the more people we can reach, and ultimately the more lives we can positively impact. Most people tend to think of performance-enhancing drug use as primarily a professional sports issue, but almost 2 million young people admit to using these substances, and more kids use them to improve their appearance and self-esteem versus on-field performance. And most people are shocked to find out that the fastest growing segment of users are young girls who are trying to feel better about themselves. This is why we coined the term APEDS, or appearance and performance enhancing drugs, versus just performance enhancing drugs. Since 2007, with a staff of only 5 people, we've directly presented our education programs to over 500,000 people in the US, Canada, and Latin America. And we know these programs are effective because of independent research have shown a significantly positive impact relative to awareness and attitudes on the issue. Further proof of our success is that we were awarded a grant by the Rhode Island Foundation to conduct our programs in every single high school in the state. Our Texas-based organization was selected to work with the Rhode Island Interscholastic League to lead this effort. The first challenge we face is quite simply awareness of the issue. Research shows that many adults incorrectly believe this is more of an issue at the professional level, not among our young people. However, the data shows the usage of these products exceeds the usage of several other well-known illegal drugs. The second challenge is that too many schools and coaches are in denial about the issue, even in some schools where tragedies have occurred. They think that by bringing our program in, they're signaling to parents and others that they have a problem, when instead they should simply look at this as prevention. We would love to be able to provide our programs to schools at no cost to them. This would eliminate some of the hurdles that we face and allow us to simply focus on delivering the message versus having to sell the program. Additional resources would allow us to establish a scholarship fund where schools could apply for a grant that could cover the cost of the program as well as our travel expenses. With additional funds, we would also be able to expand our staff, thereby allowing us to reach more people. Our organization is focused on education and solutions to this issue, but unfortunately, the issue is not at the forefront of the minds of our parents, teachers, coaches, and other adult influencers. Schools have rightly focused on drug and alcohol prevention in the classroom for years, despite usage of appearance and performance-enhancing drugs that are reaching epidemic levels. This subject still goes without discussion. We would love the opportunity to create public service announcements on the subject that could run in the media nationally to generate awareness. We would need additional funding to cover production costs.